Today we'll be discussing Adderall and its role in toxicology. Adderall is a prescription medication that contains a combination of amphetamine salts, specifically dextroamphetamine and amphetamine.
Oh, wow.
It is commonly used to treat attention deficit hyperactivity disorder, or ADHD, and narcolepsy.
Grip, you have got to be fucking kidding me. Is Noir sleeping?
Mm-hmm. Oh, shit! Sorry, you guys, I'm narcoleptic.
What the fuck?
However, misuse, overuse, or accidental ingestion can lead to toxicity and require prompt recognition and treatment. In today's session, we'll review Adderall's mechanism of action, the clinical manifestations of toxicity, and management strategies for overdose. Starting with mechanism of action. Adderall's effects are due to its action as a central nervous system stimulant. It increases the release of neurotransmitters such as dopamine and norepinephrine in the synaptic cleft and inhibits their reuptake. This results in increased neurotransmitter concentration in the prefrontal cortex, which helps improve focus and reduce hyperactive behavior in ADHD patients. However, at higher doses, this can lead to excessive stimulation of the CNS and peripheral adrenergic receptors, which contributes to toxicity. Additionally, Adderall stimulates alpha and beta adrenergic receptors, leading to vasoconstriction, increased heart rate, and increased blood pressure. The half-life of Adderall is about 9 to 14 hours, depending on the formulation and individual metabolism, which can prolong symptoms in cases of toxicity. Regarding the clinical manifestations of toxicity, toxicity from Adderall can occur due to accidental ingestion, intentional misuse, or therapeutic overdose. Symptoms of Adderall toxicity can be categorized into CNS and cardiovascular symptoms, but there are also other organ symptoms that may be affected. Regarding the CNS symptoms, early signs include restlessness, anxiety, irritability, and insomnia. As toxicity progresses, more severe symptoms like confusion, hallucinations, delirium, and psychosis can occur. Severe cases may result in seizures, coma, and cerebral hemorrhage due to hypertension. Regarding the cardiovascular symptoms, common findings include tachycardia, hypertension, and palpitations. Severe overdose can lead to cardiac arrhythmias such as ventricular tachycardia, ventricular fibrillation, and myocardial infarction. Patients may also present with chest pain due to increased cardiac workload and potential for myocardial ischemia.
But wait! There's more!
Now, regarding the other symptoms, hyperthermia is a critical sign of severe stimulant toxicity and can be life-threatening if not managed. Gastrointestinal symptoms like nausea, vomiting, and abdominal pain are also common. Rhabdomyolysis can occur due to hyperactivity and muscle rigidity, leading to acute kidney injury if left untreated. It's important to note that the severity of symptoms is often dose-dependent, and certain individuals, like those with underlying cardiovascular disease, may experience more severe symptoms even at lower doses.
Do you even know how to take out this kind of threat?
Yes, sir!
Now, regarding the management of Adderall toxicity, the management of Adderall toxicity involves stabilizing the patient, providing symptomatic treatment, and preventing complications. Initial assessment and stabilization. We're going to check the ABCs, airway, breathing, and circulation, should be assessed immediately. Patients should be monitored with continuous cardiac monitoring and pulse oximetry. Obviously, we're going to obtain a 12-lead ECG to evaluate for any arrhythmias and establish IV access and initiate IV fluids for dehydration and hypotension. Regarding the symptomatic management, for agitation or psychosis, benzodiazepines such as lorazepam or diazepam are the first-line treatment.
Ow! Ow!
Benzodiazepines help reduce CNS hyperactivity and are also effective in managing seizures. For hypertension and tachycardia, benzodiazepines can be beneficial, but if additional therapy is needed, alpha blockers like phentolamine or beta blockers such as labetalol may be used. Caution with beta blockers alone is advised, as they can potentially lead to unopposed alpha adrenergic stimulation, worsening hypertension. For hypothermia, aggressive cooling measures such as ice packs, cooling blankets, and IV cold saline should be initiated. Decontamination. Activated charcoal can be considered if the patient presents within 1 to 2 hours of ingestion and is alert, though it is typically reserved for large ingestions. Gastric lavage is generally not recommended due to the risk of aspiration, especially in patients with altered mental status. For severe cases with refractory symptoms, patients may require intensive care with close monitoring of cardiac and neurological status. IV sodium bicarbonate may be considered for QRS widening or acidosis. Hemodialysis is rarely indicated since amphetamines are not highly protein-bound, but it may be considered in life-threatening cases with renal failure secondary to rhabdomyolysis. Patients with mild symptoms can often be observed in the emergency department and discharged once symptoms resolve. Those with moderate to severe symptoms should be admitted to a hospital or intensive care unit for further monitoring. In summary, Adderall toxicity is an acute medical emergency that requires prompt recognition and intervention. Its effects on the CNS cardiovascular symptoms can be life-threatening, but with appropriate symptomatic management and supportive care, most patients can recover. The key to successful management is early intervention, appropriate use of medications like benzodiazepines, and careful monitoring for complications.
Hey! Come on, man! That's too easy!
As healthcare providers, it's crucial that we educate patients on the risks of misuse and ensure safe practices in prescribing stimulant medications. As always, keep your head up. You're doing great. You're better than what you were yesterday. And that's a lot. Learn something new today. Going to be a great doc. Sometimes you just got to hear that. Are you an emergency medicine professional or a medical student eager to sharpen your toxicology skills? Well, look no further. EM Toxicology Trainer is your go-to app to mastering the essentials of toxicology and toxicological emergencies. With EM Toxicology Trainer, you can dive into the mechanisms, symptoms, and treatments of common overdose scenarios right at your fingertips. Learn what happens in the body when venlafaxine levels go too high, or how to handle a dangerous Tylenol overdose. Our app makes learning toxicology easy, with concise explanations that reinforce your knowledge on the go. No more scrambling through textbooks or online searches when time is critical. Whether you're in the ER or prepping for exams, EM Toxicology Trainer gives you the confidence to tackle toxicology cases with precision and speed. Download EM Toxicology Trainer today and become the expert your patients need when it matters most. Available now on iOS and Android.